spray pump. The system was extremely unpleasant and difficult to use, but Lister's staff suffered in silence, though one irreverent person was heard to intone, "Let us spray," at the beginning of an operation. But despite its success in Lister's hands, the carbolic regime was not quick to catch on. Surgeons elsewhere were unconvinced of the need for this troublesome procedure.
America was very slow. There was a conservative faction in surgery that said we shouldn't change. And in a way, medicine, science, fields of learning always have the conservatives saying let's not change our thinking and the radicals saying let's change. There's always a tension there. It's a healthy tension. And in this country we were slow, but finally, of course, we did.
One of the first American surgeons to take up Lister's ideas was William Halstead of Baltimore, a man who would dominate American surgery for 3 decades. Halstead had studied in Europe, where he'd been converted to the virtues of antisepsis. But at the moment, the antiseptic regime was presenting him with a personal problem. His theatre nurse, Miss Caroline Hampton, was allergic to the carbolic. The rash on her hands became so severe that she threatened to desert her post. Halstead had seen excellent results from following Lister's techniques, and he was loath to abandon them. On the other hand, he was most upset at the prospect of losing Miss Hampton's services. So he contacted the Goodyear Rubber Company and asked them to make her some rubber gloves. The reason for Halstead's extraordinary solicitude became apparent the following year, when he and Miss Hampton were married. Miss Hampton's gloves were to protect her hands from the antiseptic. Later, gloves would be universally adopted to protect the patients from the surgeon's hands, which Robert Koch, the German bacteriologist, had incriminated as a prime source of wound infection.